I'm Adam Hawkins. I am the Vice President of Healthcare and Life Sciences at Herjavec Group. I'm responsible for the growth and management of our clients in those verticals. Healthcare is struggling with three common pain points that seems to cross both payers, providers, and people that work in the healthcare industry. One is their lack of sophistication and internal capabilities around various tool sets. The second is the ability to manage those things long-term and get value out of them. And third is to really connect those things in their enterprise and make sure that they work with a partner that acts as an extension of their team.
Sharp HealthCare is San Diego's largest healthcare provider, 7 different hospitals. We've got 3 different healthcare groups, and then we also have a health plan. So my team inside of what we call IT risk management, I run the information security organization that's comprised of a couple different areas. One side of the team is identity and access management, very traditional identity and access management group. Other side of the team is security operations, security engineering, and security architecture. The folks on my team are responsible for the security engineering, the security architecture of our information security footprint, but then we look for trusted providers to kind of make up the rest. So we look to trusted partners to do things like that, and that's why we came to Herjavec Group, is to kind of fulfill that level 1, level 2 security operations center function for Sharp. And then when there is something that Herjavec needs to escalate to my team jumps in as kind of the level 3 security analyst, and then we bring in the security engineers, the security architects into that. We really were looking for somebody that could be a partner not only for the security operations space, for us outsourcing some of our security operations center functions, but also a partner that we could learn, develop, and grow with over time. We have a tremendous problem with phishing, like most healthcare institutions do. So social engineering attacks, standard phishing attacks, business email compromise, malware threat inside of healthcare is very, very high. One of the areas that Herjavec was able to kind of specialize their offering was we have a pretty unique phishing workflow. So we ask our users to be vigilant, and if they find an email that seems to be a little bit odd, we ask them to forward it or use a button to send it to our team that then investigates. Herjavec is now our partner that actually receives those reports and does some investigation on is it a legitimate email? Is it actually phishing? Did the user do something with that email? Did they click on something? Do we need to go after it? And with our partnership with Herjavec, we were able to design a custom workflow to meet this need and build some automation behind it as well. So we've been really happy with the work in that phishing workflow.
Healthcare does not need more tools and more widgets to help them address their security problems. They need those tools to work and talk with each other and to show value out of the money that they're spending in those areas.
I think what's really important to our team is to have a partner that is big enough to have significant knowledge and infrastructure and correlation abilities, but yet small enough to kind of customize themselves to our specific wants and needs. And Herjavec is that.